The popularity of laser hair removal is increasing these days for both men and women. Regarded as a cosmetic procedure, the treatment provides interested individuals with an easier way of getting rid of unwanted hair. Laser hair removal is equipped with cutting-edge technology which makes it less painful than waxing. Besides, getting rid of hair on certain hard-to-reach body parts gets easier than having to slightly warm up to get your arm dislocated to shave that hair on your back, which makes the treatment far easier than tweezing, waxing, or shaving unwanted hair. However, the treatment does not come without certain risks, which most people are usually unaware of. Conveniently and seamlessly lasering out your hair to oblivion comes at the expense of both safety and some other side effects. So what are these side effects? Anything you should be aware of? Should you spend sleepless nights ahead of the treatment or not get any laser hair removal at all? How does it work? Laser hair removal employs a process called elective photothermolysis. To put it simply, the treatment heavily relies on heat or energy generated from the laser light. The laser light then emits safe light energy that targets the root of your hair and follicles. Does it hurt? The treatment will not give you nightmares as all procedures are safe. Whether it hurts or not, that is a completely different story. The pain that people get from laser hair removal is usually minimal, but by how much? Well, most who have had the treatment before said it feels like snapping a rubber band on your skin. You might want to try snapping one to get the idea. So the answer is yes, the treatment does hurt, but often not by much. Other than that, slight discomfort usually begins to take place during the first 48 hours post-treatment. You might experience two types of discomfort, including redness and swelling only in the areas affected by the treatment. Usually these appear in just a few hours after getting your treatment. What are the side effects? After noticing redness and swelling post-treatment, you may also experience irritation, which is a very common side effect. These three side effects, however, are very minor and again are only temporary. These very same side effects may be found in waxing. As soon as you experience this trio of slight discomfort, the professional or dermatologist might apply you topical anaesthetic to minimise these effects, usually right before getting the treatment. After the treatment, you may also apply ice packs to reduce swelling and other pains. However, should it last longer and you notice it gets worse, or perhaps you notice something different, it is best to call the doctor or anyone who helped you with the procedure. There is a slight chance of pigment changes and tone differences on areas of skin affected by the treatment. For example, you may see either slightly darker or lighter skin tones. You might have darker spots after treatment, which are very noticeable for anyone with lighter skin, and vice versa. However, this particular side effect, like previous ones, is common and not a cause for concern. Are there any severe rare side effects? Whilst these side effects are rare, laser hair removal can lead to some more severe problems than the ones mentioned previously. But like any other medical procedure, any treatment by someone who is not a certified trained professional, alongside buying at-home kits from a questionable provider and using it without proper guidance, is something that you should not do. These side effects are as follows. Excessive hair growth in the area of treatment. Oftentimes, this is mistaken for hair shedding post-treatment. Changes to overall skin texture. You are very vulnerable to this if you have undergone a tanning procedure. Scarring is the most common in those who scar easily. And lastly, blisters and skin crusting. You are likely to experience this should the area of treatment be exposed to direct sunlight too soon after the treatment. How about pregnancy? Is laser hair removal safe during pregnancy? Well, it is not recommended. This is because there are no proven studies that laser hair removal is safe during pregnancy. Should you or anyone you know be keen on removing unwanted hair growth on the breasts and stomach during pregnancy, you might want to put this on hold, since hair in these areas tends to fall on its own. So perhaps the appropriate response is to wait until you deliver and discuss with a doctor or professional when it is safe to carry out your laser hair removal treatment. How about infertility? The laser used in the treatment only affects your skin's surface, and the very minimal amount of radiation used cannot penetrate into the organs, so it will not affect fertility. Does the treatment cause cancer? It is a myth that laser hair removal causes cancer. In fact, according to the Skin Care Foundation, which is a highly respected international organisation, laser hair removal treatment is sometimes used to treat certain forms of precancerous lesions. Many people have concerns over the use of lasers in both medical and cosmetic scenes, which is understandable, but the light laser used in laser hair removal treatment poses a very minimal amount of radiation. This radiation is only used on the surface of the skin. Therefore, it poses zero risk of cancer. Again, is it safe? Generally, yes. You don't have to worry much about the procedures, but there are some precautions that you must take, such as avoiding having the treatment near your eyes, avoiding getting it done during pregnancy, and it is best to avoid at-home laser hair removal kits. You might want to note that the procedure is not a 100% effective permanent hair removal solution, as different bodies react differently to the treatment. Therefore, you could have multiple sessions, while others will only need a few. So, have you decided to book a laser hair removal treatment? Please like, comment and subscribe.